The okay. Crystal Gardner and Gabby Abalafia are new to us, so welcome. Marissa Miller, I don't know that I've met you, so welcome everyone. I'm Beth Najberg, as you can see. I'm the facilitator of our Spotlight series. And we're in our third year, and I'm so excited about this program because it's going into such depth. We have 4 speakers talking about the huge disparities in Black maternal health. And I'm going to turn this over to Jill Lexier, who is the SPA State Policy Advocate for National Council of Jewish Women in Illinois. And then she'll introduce the speakers. So welcome.
Thank you, Beth. Thank you. Yes, I'm the State Policy Advocacy Chair, which means that I coordinate the policy work and the advocacy actions for NCJW in Illinois. I'm very, and so if you're interested in any of the work that we do, I'm going to pop my my contact in the chat, and Beth will also include it in the follow-up materials. But I'm very pleased today to bring you an issue that is so important. It's at the intersection of our work on reproductive health and racial justice. I mean, NCJW has actually been working on reproductive issues, well, really since its founding in 1893. And here in Illinois, we've been a longstanding and active member of the Illinois Reproductive Health and Access Coalition, along with ACLU, Planned Parenthood, EverThrive, who we have with us today, and other partners, some of who are on the call. So thank you so much for attending. And through the coalition in 2019, we passed the Reproductive Health Act here in Illinois, which will protect rights to reproductive health, including abortions, here in Illinois, regardless of what happens to Roe v. Wade. I know it's very small comfort for us, given that the Supreme Court has announced that they will be taking on the Mississippi case. The sad truth, though, is that while we may have rights, the reality for many people, especially Black and Brown women, is that good quality health care is not always available, accessible, or affordable, and nor are the people that provide that care listen to people or respect people. So, so that really is a huge disparity. You know, here we are marking the year anniversary already of George Floyd's murder, and we're sort of finally coming out of this pandemic. And what it has laid bare for us is the systemic racism in our country and the impact on healthcare. That I think that was pretty obvious during the pandemic. And there's not the more glaring health disparity than in maternal health care. And so today we're going to examine this more closely. We chose the month of May because it's the month in which Mother's Day occurs. What were we thinking though? It's the last week of the legislative session, so it's really very busy for people who do this work. So we really want to thank all of you participants who are here, and particularly our speakers today, because I know it's just a really very busy time. And we'd actually invited Lauren Underwood to attend, and of course she is very busy. But she does have a message for us, and which we'll play shortly. And of course, Lauren Underwood is our 14th District Congressperson. She is the youngest African-American woman to ever serve in the House of Representatives, and she co-founded the Black Maternal Health Caucus. After we hear from Lauren, and because she can't attend to answer any more questions further about the Momnibus, we have Shannon Russell, who is from our NCJW office in DC. She is legislative counsel, and she is our expert on reproductive issues. She actually has been working with Congresswoman Underwood and her staff on this Momnibus issue. So she's available to answer any questions on that. Then we're going to narrow our focus here in Illinois. We're very pleased to be joined by our partners in this work, Kelsey Landers and Sheila Sanders from EverThrive, Illinois. Together, they're going to review the really shameful results of an Illinois Department of Public Health maternal morbidity and mortality report. They're also going to review policy and legislative work going on here in Illinois, very much informed by experiences and stories from the field. So again, very pleased to have Kelsey with us. She is the Policy and Advocacy Director, and Sheila Sanders, who is the Community Engagement Director. So that's our program for this evening. Again, so glad you could join us. I'm now going to turn this program over to the duties over to our Chicago North Shore Section President, Deborah Wiedinghoff, who is going to introduce the message from Lauren Underwood and say a few words. Thank you.
Thanks, Jill. Jill, I'm going to probably double up on a few things Jill already has said. But I'd like to welcome everyone and thank you for joining us this evening for NCJW Chicago North Shore Spotlight Program. Tonight's topic is one of the many community equity issues we explored during our Anti-Racism is a Verb 18-week challenge. The challenge was an educational series in response to the murder of George Floyd, which, as Jill said, occurred 1 year ago today. So tonight is fitting for us to gather and continue to educate ourselves and advocate for racial equity. We are going to begin with a recorded message from Congresswoman Lauren Underwood. And as Jill said, she represents Illinois' 14th Congressional District and is the co-founder and co-chair of the Black Maternal Health Caucus and introduced the Omnibus Bill or Act in the House of Representatives in February. While the video lasts about 3 minutes, make sure you keep yourselves on mute so there is no feedback. And I'm going to share my screen with you. And wait a minute. Nope. You know, it always works in practice, right? There she goes.
Hi, everybody. I'm Congresswoman Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I'm excited to join you for this important conversation about our nation's maternal mortality crisis, which disproportionately impacts Black mothers and other women and birthing people of color. It's unacceptable that the United States, the wealthiest country on earth, has the highest maternal mortality rate in the developed world. And for women of color, the risks are even greater. Black moms are 3 to 4 times more likely to die from pregnancy-related causes than white moms, and Hispanic, Asian, and Native American birthing people also experience elevated risks of mortality and morbidity. As a co-founder and co-chair of the Black Maternal Health Caucus, I'm committed to the critically important mission of advancing legislation to save moms' lives and racial and ethnic disparities and achieve true equity and justice for all. To address the root causes of maternal mortality, morbidity, and disparities, we need data-driven, evidence-based policies that center the voices of families impacted by this crisis. That's why in February, I introduced the Black Maternal Health Omnibus Act with Senator Cory Booker, Congresswoman Alma Adams, and now more than 120 House and Senate co-sponsors. The Omnibus, which I first introduced in 2020 with then Senator, now Vice President Kamala Harris, is a suite of 12 bills that build on existing legislation to comprehensively address every clinical and non-clinical driver of this crisis. For example, the Omnibus includes policies to provide trainings on bias and racism to maternity care providers, ensuring that clinical care is consistently respectful and culturally appropriate for every pregnant person and new mom. But the legislation also recognizes that social determinants of health, like housing, transportation, and environmental conditions, also impact outcomes for moms and babies. The Omnibus includes funding to ensure that every mom has access to the robust social services that they need and deserve throughout pregnancy and for the full year-long postpartum period and beyond. One of the most important social determinants is nutrition. And there's robust evidence proving that the WIC program, which provides nutrition support to women, infants, and children, improves health outcomes for moms and babies and even reduces mortality. However, many families that need WIC the most don't have access to these benefits. The Momnibus would extend WIC eligibility in the postpartum and breastfeeding periods, ensuring that new moms and children can receive the nutritional support they depend on. The Momnibus also includes provisions to support women veterans and incarcerated moms, as well as people suffering from mental health conditions or substance use disorders during or after pregnancy. There's also funding for data collection enhancements and digital tools, investments in the perinatal workforce, and policies specific to COVID-19. These are necessary investments that will save lives and support families. And I look forward to working with my Democratic and Republican colleagues in the House and Senate and the Biden-Harris administration to get the Momnibus signed into law, because every mother deserves access to the care and support they need during pregnancy, throughout labor and delivery, and for the full year-long postpartum period and beyond. So thank you for shining a light on these issues, and thank you for all the work that you do and will continue to do to save lives. I'm so honored you invited me to join you for this event, and I look forward to the day that we're back together again in person. But until then, take good care of yourselves, everybody.
So we appreciate that Representative Underwood took the time to send us that message. She packed an awful lot of information into 3.5 minutes. So, and I've listened to it a number of times. So I hope we will have maybe flesh it out a little bit more. So Jill, is it back to you to introduce the first person?
I think we can just go right to Shannon.
Okay, Shannon. Wait.
Can you see my screen?
Yes.
Great. So, hi everyone. Thanks so much, Jill, for introducing me and for inviting me to speak tonight. I'm so grateful to all of you for joining us to learn more about such an incredibly important issue. As Jill said, I'm Shannon Russell, NCJW's Legislative Counsel, and I use she, her pronouns. I'll begin with a little bit of framing surrounding NCJW's reproductive health rights and justice work. So as Jill also mentioned, for over 125 years, which is a really long time, we've supported access to family planning and reproductive health care. And as such, NCJW was an early advocate for safe abortion care. And we continue this vital work today to ensure that all have access to this essential health care in whatever settings they choose and at whatever time they choose. And we're guided in this work by our Jewish values like kavod habriot, or respect and dignity for all human beings. And we're aiming to create this world where everyone, regardless of factors like race, income, gender identity, sexuality, are able to control their bodies, families, and futures. So where does our work on Black maternal health fit in? More specifically, we're calling on our leaders to use a reproductive justice framework of analysis. As I'm sure that you know, reproductive justice is a framework, movement, and a vision that was created and is still led by women of color that's grounded in basic human rights. Reproductive justice takes into account the many factors impacting a person's ability to exercise these rights, like gender, race, or age. So for instance, bans on abortion coverage and access to healthcare impede reproductive justice, and they fall hardest on those who are already facing structural barriers to exercising their human rights. And these are people that are struggling to make ends meet: Black, Indigenous, and people of color communities, young people, immigrants, rural communities, people living with disabilities, and LGBTQ individuals. NCJW works as an ally to and is led by our reproductive justice partners in the fight for equality. So when I first began working at NCJW about 2 years ago, I noticed that we were already working on abortion access and access to contraceptives, safeguarding religious liberty, and comprehensive sex ed. But in keeping with our commitment to advancing reproductive justice, I thought that there was something missing, and that's the final bullet point. Addressing the nation's maternal mortality crisis and persisting racial disparities in maternal health outcomes. Our reproductive health rights and justice work is not just about protecting everybody's ability to decide whether and when to become a parent, but it's also about the ability to birth, parent, and adopt with dignity, and to make sure that everybody can thrive in their own communities. So this is why NCJW has endorsed the Black Maternal Health Momnibus Act, which we just so wonderfully heard Congresswoman Underwood talk about. And this is a comprehensive initiative that she leads alongside Rep. Alma Adams and Senator Cory Booker to address the tragic health disparities that are faced by women and birthing people of color, and to protect mothers everywhere. So as Congresswoman Underwood said, the Momnibus is composed of 12 bills that aim to address every aspect of the maternal health crisis, and specifically targeting communities with particular needs, such as incarcerated individuals, pregnant and postpartum veterans, and those who live in underserved areas. Critical provisions include improving data collection processes and quality measures to better understand the causes of the maternal health crisis, providing funding to community-based organizations that are working to improve maternal health, making critical investments in social determinants of health that influence maternal health outcomes. These are things like housing and transportation and nutrition, like she was talking about access to WIC, and investing in digital tools like telehealth to improve maternal health outcomes in underserved areas. So these are the 12 Momnibus bills. I know that this is a big list, so I'll read you the names of the bills, and linked here are the congress.gov pages where you can find more important information on the bills, like who is co-sponsoring them and bill text, so I can share that. So the bills include the Social Determinants for Moms Act, the Kira Johnson Act, Protecting Moms Who Served Act, the Perinatal Workforce Act, Data to Save Moms Act, Moms Matter Act, Justice for Incarcerated Moms Act, Tech to Save Moms Act, Impact to Save Moms Act, Maternal Health Pandemic Response Act, Protecting Moms and Babies Against Climate Change Act, and Maternal Vaccination Act. So we could talk about all of these bills for days. It would take us a long time, so I'm just going to spotlight two of them. The first is the Protecting Moms Who Served Act, which is HR 958/S976. And I'm spotlighting this tonight because it's actually the first Momnibus bill that passed the House almost 2 weeks ago on May 12th. So this bill would codify and strengthen the Department of Veterans Affairs maternity care coordination programs, and it would also commission the first ever comprehensive study on the scope of America's maternal health crisis among women veterans, with a particular focus on racial and ethnic disparities in maternal health outcomes. Since it passed the House, this bill is now moving on to the Senate, where it's led by another amazing Illinois lawmaker, Senator Tammy Duckworth. So the other bill I want to highlight tonight is the Kira Johnson Act, which is HR 1212/S1042. This bill, of course, is named for Kira Johnson. May her memory be for a blessing. And her picture and her story you can see on the screen. Appallingly, Kira died on the operating table while ongoing emergency surgery after her bladder was lacerated during a C-section. Kira had been bleeding internally for hours, but she and her family were ignored by doctors and hospital staff. Unfortunately, this pattern of behavior, undervaluing, diminishing, or outright ignoring Black women's pain, is far too common amongst providers who are sometimes still taught in medical school that Black people somehow have thicker skin or experience pain differently than white people. To be clear, this pattern is a direct result of systemic racism that's ingrained in medicine and policy, and that places the health and well-being of birthing people of color as inferior to that of white people. This is what the Kira Johnson Act does, and I chose to spotlight it because I think it's a really important and meaningful piece of legislation. So it's clear that this legislation is long overdue, as women and birthing people of color are in crisis. As Representative Underwood also mentioned, the United States is the richest nation in the world, but we hold the grim distinction of the highest maternal death rate. amongst developed nations, with Black moms dying of pregnancy complications at 3 to 4 times the rate of their white counterparts. Research from the CDC has similarly demonstrated that rates of maternal mortality amongst American Indians and Alaskan Natives and Asian Americans and Pacific Islanders are also higher than that of white women. Therefore, the Black Maternal Health Omnibus Act would bring about much needed drastic change. Indeed, the CDC has confirmed that 60% of all pregnancy-related deaths can be prevented with improved access to and better quality healthcare, communication, and support. And that's exactly what the omnibus bills aim to do. NCJW support for this legislation is grounded in the Jewish value of social responsibility, which morally obligates us to protect every single person's health and to right injustices that currently exist. So as Jews, we have a sacred duty to speak out against racist systems, structures, speech, and actions, and to work toward a more just future. We must end disparities in maternal health because safe, equitable, affordable care and equal access to comprehensive, high quality, and culturally competent services is a basic human right. NCJW supports the Omnibus Act as a means to this end and moving us closer to a world where all can access the family planning, reproductive, sexual health, and maternal health services they need. So I'm going to talk briefly about legislative strategy. NCJW has endorsed the full package of 12 bills, but as I'm sure that you're aware, our federal Congress is very divided, perhaps more so than they have been in a long time. So it's hard to get even one bill through the legislature, let alone a massive package of 12 bills. So that's why we're aiming to advance these bills individually rather than as a larger package. And we're also seeking to advance the omnibus priorities through the appropriations process. So those of you who are familiar with the appropriations process through the Hyde Amendment, which is something that we strive to get out of annual funding bills, these are things that we're trying to put into annual funding bills because they are money that would go to support research and programs that would improve maternal health outcomes. And so I've also included some take action links here and some resources. So these are NCJW's action alert and talking points on the omnibus bills, the Black Maternal Health Caucus website, and also a link to resources from the Black Mamas Matter Alliance, which is an amazing organization doing this work.
Thank you so much, Shannon. Does anybody have a quick question or two for Shannon before we pivot to our Illinois conversation? You can just raise your hand. Maybe Beth can call on you or just speak up.
Oh, Jill, I wanted to know if she could please put that that resource information in the chat.
Well, I think you'll be getting the entire set of slides as a follow-up to the program.
Oh, okay, thank you.
Thank you for asking. Anybody else a quick question that you can think of now? If not, feel free to put it to the chat and we'll pass them along to Shannon if she can't. She can't.
Yes. Should I go ahead?
Sure, Betty, yes.
Yes, Shannon, you mentioned the U.S. had the highest death rate of African Americans in the world. Did you give a percentage on what that rate is or numbers or something?
Yeah, so the US has the highest Black maternal, let me read it exactly so I'm giving you the right numbers. The highest maternal death rate amongst developed nations, with Black moms dying of pregnancy-related complications at 3 to 4 times the rate of their white counterparts. And the CDC has said that 60% of these deaths are preventable with improved access to resources and healthcare that the omnibus would provide.
Thank you.
Thank you. Actually, that's a good segue actually to Kelsey and Sheila from Ever Thrive, Illinois, who are going to be discussing the Illinois Department of Public Health data for Illinois, Betty. So that was nationally. Now we're going to focus in on what's going on here in Illinois. And again, I'm very pleased to have Ever Thrive Illinois here. They are one of our partners in Reproductive Health and Access Coalition, and Ever Thrive Illinois is a champion for health equity in Illinois, and I'm sure they'll tell us a little bit more about their organization as well. So thank you very much. Go ahead, Kelsey and Sheila.
All right, Sheila, take it away.
Good evening, everyone. We are Ever Thrive Illinois. Just a little bit about Ever Thrive Illinois. We are a not-for-profit organization. Even though we're housed in Chicago, we do a number of different efforts throughout the state of Illinois. And our main focus is looking at health equity within families across the lifespan. And how we're able to do that, it takes on a number of different roles. One of the things that I am definitely proud of is that we cannot do this work alone. So partnerships are very important when we're looking at doing this work. And it's something to think about. If you are able to get groups of people with different resources, different access, and different knowledge and experience and wisdom, put people together to work together, you make a greater impact that way. And that is just one of the greatest things that I am most proud of within our organization. We definitely look at having a variety of different voices, not only representing the organization, but also the efforts of what we're doing throughout the state and the connectability that we're looking at to be able to do this work. And again, health equity is definitely a major focus of what we're looking at. And that looks a variety of different ways with the different initiatives that we do within the organization. We focus on definitely the health and policy aspect when it impacts families. So my greatest aspect and accomplishment to that work is that I love to be able to say we take complex information that people are definitely not familiar with, but definitely simplify it and make it digestible so people can definitely understand this is what I need to know. This is what I need to do. And these are my options to understand if you want to support or oppose upcoming bills that are coming through, and definitely understanding what does this mean and how is this going to impact me and my family, so folks can understand these are your options. What decisions do they need to make that is going to be the best for them and their families, but also working with providers and people who are interfacing different families throughout the state to understand how they need to understand not only how this is going to impact their work, but how do they explain this information with families who have not had the time to really follow what is going on legislatively for the state, and to be able to motivate them with this information so they can take the steps to know how to advocate for themselves. We do a lot of work in maternal and child health, but we also do some work that is focused on reproductive justice, and also looking at adolescent health and immunizations, and those different efforts look a little different as we look at the work that we do throughout the state. I like to say we're small, but we're mighty. And I think another takeaway with us is that we are big on our integrity, and our integrity means everything. And we sit at multiple tables with multiple people, and we find that very important to be able to do this work. Next. So when we look at the maternal mortality and morbidity, there are definitely it's important, if you all haven't had the opportunity to read IDPH's report, please do. There was a report that was released in 2018, and most recently there's one that was just released highlighting some of the findings that are below. I do want to highlight that, again, collaboration is key, and we definitely have been involved sitting at multiple tables with IDPH to be able to not only share findings of what we've heard and experienced on the ground level with different families and individuals, but also sitting at other tables with providers and other groups that are focusing on multiple areas that have helped to contribute information to some of the findings that have been that is listed below. When we look at Black individuals that are birthing, they're definitely 3 to 6 times more likely to have these experiences with maternal mortality and morbidity. And when we're looking at those that receive Medicaid coverage, they are 3 times more likely to have these experiences as well. We're in 2021 and racism and bias is still there. So it's definitely important that we address these things in a clinical setting. But definitely some of the feedback that I've heard, and I want to say I've been with the organization for over 14 years, and it's just been consistent with the type of information and experiences and stories that others have shared that just talked about the mistrust that they've experienced and how they've experienced, complications that they didn't understand or that was missed. And because they know that Black and brown people has been highly ignored in these different settings, or because they receive state issued health insurance, that they just understand that, we're not going to get the greatest care as if it's someone else with PPO insurance. And so they don't know the multiple different ways to advocate for themselves and to be able to report these different experiences that they experience, and even to know where does it go once I give this information, and who do I give it to at this clinic or hospital that I just recently received care from. And oftentimes, because we hear this more often than not in these community areas, where do they see if their voice and stories that they share is going to make it better for the next person? And who is even asking them to share their stories or having an understanding of the impact that they've experienced that is contributing to these health disparities? And when we look at the percentage, the large percentage of these severe experiences, they happen 43 plus days after giving birth. And it's amazing why this is happening and what is going on. And so when Kelsey goes to the next slide, it really just highlights some of the themes that we are hearing and seeing. I've been doing this work for years, and it's one of those things that I have heard constantly, some of the things that was shared that ends up being things. But most recently, we are working on an initiative called the Chicago Collaborative on Maternal Health. And we're currently collecting feedback from individuals, specifically in certain community areas, but just Chicago alone. But their feedback is mirroring very similar feedback that I've gotten from other individuals throughout the state. And so one of the things that was just very disheartening is just hearing how people feel like there's no support. And that looks in a variety of different ways. I remember someone who was in a younger age category and someone who was in an upper age category, both sharing how from the community, it was frowned upon that they were pregnant. And being pregnant and bringing a life into the world should be a momentous occasion for anyone in their life. And for someone to just say, why are you getting pregnant right now? Or why are you having another baby? Was just definitely off-putting and definitely not feeling the support and care that a person should receive when they are carrying a life inside of them. And so there's been a number of different feedback in regards to even being on a train and a bus and being pregnant and maybe having a child in hand and no one offering up to give up their seat. I even found it just very interesting that even in the city of Chicago, when you go outside of the city, you can go to some shopping areas and you'll see a sign that says parking for pregnant or new parents, right? Can't find one sign in a parking lot in any area in Chicago that states the same thing. But you have signs for curbside, you have signs for quick pickup. And if it's service related, you got it. But nothing that accommodates a pregnant or a new parent. And that goes back to just highlighting the lack of support that is not out there. And especially when we're looking at communities of color in particular. I was disheartened also that many were not aware of the post-birth warning signs. I've done education on the spot at community events inside the Cook County Jail. We've taken advantage of doing education games at baby showers or community baby related events. And there's so many people who are unaware of the signs and symptoms that they should be aware of post-birth. But more importantly, so many people were unaware that you can have these symptoms connected to being pregnant or delivering a child, even up to 8, 9, 10 months after delivering. And so when you look at why didn't you get this information? And it goes back to who should be responsible to share this information to make sure that you're fully aware of what could potentially happen and what should you do if you experience those symptoms. None whatsoever. And it just really goes back down to who should be responsible to make sure that this information is getting to folks. Because if folks know that these symptoms I'm experiencing is connected to me having been pregnant, then I need to act immediately. I sit on the maternal mortality review committee, and the cases that we review and we really look at and we try to determine, could this have been prevented? And one of the lingering things that come from that is that folks wait to the last minute because they did not know that these symptoms were connected to that. And by the time that they do initiate any clinical care, sometimes it's too late. And that's why it's really important that we get that information out and really explain that. I think that that's one of the reasons why when I do reproductive health education in a high school and we're just talking about understanding your body, I really talk in depth about listen to what your body tells you so you'll know how to act. Or listen to when your body is telling you that this is not a typical something. What should you do? Especially now that we're in a situation where people can have access to healthcare. So that is not a barrier to stop people from initiating getting care. We need to talk about that and really talk to people about using healthcare access as a preventative instead of waiting to the last minute for an emergency. When we look at looking at postpartum checkup, it is very common and often that people do not go for their postpartum checkup, partly because they know that their kids have multiple well visits, right? And if they have a job and an employer is going to give them a certain amount of time because they just had a baby, but they're sticklers about schedule and how many hours you do, they will forfeit their own checkup just to make sure that their children have their well visit and their well care. And a lot of times, sometimes there's a multiple ways of looking at this. And they say, well, I know my relatives years ago used to deliver babies at home and they didn't have to go to the hospital and they didn't have to go for follow-up and things like that. But what they forget and miss is the nuances of there was a midwife that would come to the home and check on them. There was also one of those things of our lifestyles are so different years ago than to where we are right now. And not to say that there isn't a layer of stressors in our life, but I think that we are living in a day where we're so heavily stressed to try to work and try to go to school and take care of the household, take care of the kids, and making sure that there's lights on and food on the table, that we continue to stress ourselves and sacrifice ourselves to make sure everybody else is taken care of, and we're the last on the totem pole. And I can admit that to myself as well. Self-care is very important. So I always have that discussion, like, how do you give self-care to yourself, and what does it look like? And I think that is really important for us to continue to talk. And because of the historical stories that other families have shared, and more importantly, different experiences that they've experienced, is that because of that, that continues to leave with the distrust in the medical system. And that's another reason why people don't go back for follow-up. That is one of the reasons why people don't go until the last minute, because of the distrust, feeling like you're less than, especially if I'm coming in with state issue health insurance, how they treat us differently than they treat somebody else who has premium health insurance. And then it's one of the things that is really important, that it even looks different depending on where you are in the state. Because if you have state issued health insurance, sometimes you can't go to the hospital or clinic that is closest to you because of the type of plan you have. You have to go somewhere that is 45 minutes or an hour away just to be able to access services. And these are the ongoing conversations and feedback that we hear more often than not as to the reasons why these things continue to happen in Black and Brown community areas.
Thank you so much for that, Sheila. I'm going to advance the slide. And I apologize if you hear my 2-year-old yelling in the background. She's very adventurous. And also, I'm going to be looking over at my notes just so I can make sure that I get all of the stats and information accurate for you all. Okay. So as you look at this slide, you'll see that the first box says MMRC, and that is what Sheila was referring to earlier about the Maternal Mortality Review Committee. The MMRC puts together recommendations, right? They are a group of experts that review every single death to a person who was pregnant at the time of passing or was pregnant in the year preceding their death. And as Sheila mentioned, I was going to plug you, Sheila, as a member of the MMRC. You can find her name in those reports, as well as other members at EverThrive Illinois. So this group of experts informed the recommendations for the first and second IDPH reports. The cycle of change related to maternal mortality and morbidity policy in Illinois has largely followed the track that you see in front of you with the arrows. After the reports come out, there's media attention and elevated awareness of maternal health disparities. Advocates and legislators look to the MMRC and IDPH for the most evidence-based policy recommendations to implement. We've had some very big policy changes in Illinois that have occurred since the 2018 report. One thing specifically, is something called the postpartum expansion. For some background, people who earn above 138% FPL do not qualify for traditional Medicaid coverage. When I say Medicaid, I'm talking about the public health insurance. It's also referred to as MCOs or by the names of the individual insurance companies that provide Medicaid care, like Illini Care, for example, Cook County. If you fall between 138 and 213% FPL, you qualify for Medicaid coverage under the Illinois Moms and Babies program. Until April of this year, when the postpartum expansion was approved by federal CMS, people would lose coverage at 60 days postpartum if they fell between 138 and 213% FPL. For anyone who has welcomed a child into their lives, we know more often than not, all of our medical needs remain after 60 days postpartum. Our health needs do not disappear at the arbitrary date of 60 days. Luckily, Illinoisans with Medicaid will now have 12 months of continuous coverage after giving birth. This expansion is a direct recommendation from that 2018 report and has been supported by ACOG and other advocates for a while. To repeat what you heard earlier, a large percentage of maternal deaths occur after 43 days postpartum. We hope that this expansion helps individuals connect to care after giving birth, because we know you cannot address everything in 60 days. Well, this next policy win, you'll see number 2, did not stem from the IDPH report. We at EverThrive know through our pregnancy care advocacy that blood pressure monitoring is especially important for people considered at risk for preeclampsia. Last year, when medicine shifted to a virtual environment, we heard from doctors affiliated with the Illinois Perinatal Quality Alliance that pregnant and postpartum folks with Medicaid were having a lot of trouble accessing home blood pressure monitoring kits. And that was getting in the way of them being able to participate in their virtual prenatal appointments. Through our successful administrative advocacy, we were able to loosen the restrictions around prior authorization for home blood pressure monitoring kits, and we made that flexibility permanent. Another exciting policy win, if you look at number 3, oh my goodness, I lost my place. Another exciting policy win that stemmed from the 2018 report is Medicaid reimbursement for doulas and home visitors. HB 158, that's the bill number, was the 4th pillar of the Illinois Legislative Black Caucus agenda for this year. That bill included a number of policy changes that will hopefully improve healthcare outcomes. For example, now, this is new, Medicaid providers will be required to engage in implicit bias training when they recertify their licenses. Doulas and home visitors will be able to bill Medicaid and provide services to people with Medicaid, as will community health workers. EverThrive Illinois spent a lot of time advocating for the doula and home visitor provisions because our community engagement work, as Sheila said, highlighted the need that pregnant people need more support during pregnancy, during labor and delivery, during the postpartum period, and in that interconception period, or the time between births. And finally, the WIC program has become more accessible in the last few years. WIC in Illinois no longer uses paper coupons, as you might remember, and people can access their benefits on a link card. This card is very similar to the card that individuals use for SNAP benefits or for TANF cash benefits. People who participate in WIC can also use their nutrition vouchers at any WIC retailer, as South and West Side residents are no longer required to shop at food and nutrition centers, which were Catholic charity-run WIC stores in Chicago. By making the WIC program more flexible and easier to use, allowing people to shop where they need to, whether it's closest to their work, their child's daycare, we can hopefully increase participation and retention. And I believe it was Shannon who mentioned during her, no, it was Shannon and Congresswoman Underwood mentioned the importance of WIC. WIC is evidence-based. It has been around for decades. It improves access to breastfeeding support. It improves the health of the pregnant person, of the children. It really is, it is a great program. Sadly, Illinois lags behind over 30 other states in WIC participation and retention. And I'd love to share with you all in the follow-up materials, the Making WIC Work report that EverThrive and our partners put out that led to these coupon flexibility changes in Illinois. The most recent maternal mortality and morbidity report from IDPH built upon the 2018 report. However, they have a specific focus on connecting people to postpartum follow-up visits and policy recommendations related to that. In some of our community outreach, we learned that there is a significant lack in postpartum education amongst pregnant people in Illinois. And we think it's essential for providers to make sure that every person who comes into the medical office leave with the information that they need to stay healthy, as Sheila mentioned so well. I'm gonna, quickly go through this slide since we had a really great federal walkthrough earlier. But some things that we didn't talk about. Last month, the Biden administration honored Black Maternal Health Week. It was the first proclamation of its kind. Illinois' very own Congresswoman Underwood introduced those 12 standalone bills that make up the Momnibus. And we heard that the veteran healthcare system bill passed out of committee a few weeks ago. We're also hearing some rumblings that President Biden's Future American Families Plan could include a huge infusion of money for states to improve maternal health systems. And last but not least, the American Rescue Plan, so many American plans. The last COVID relief bill included a state plan option for every state's Medicaid program. So something that HFS or the department that manages and implements the Medicaid programs can apply for a state plan amendment to extend postpartum coverage from 60 days to 12 months. Very similar to what just got approved in Illinois. So now every state will be able to access this in an easier way starting April of next year. And then to close, I'd like to share that there is a lot happening at the local, state, and federal levels to address the rising rates of maternal death and complications. I am very hopeful that we can create a better system in Illinois to serve pregnant folks and their families. This is how you can get in touch with us. We're always available to answer questions that you might have, or if you want to send us any policy happenings that are happening out there in the world that you think we should know about, we are more than happy to chat with you. And I see that there are a lot of questions in the chat. Sheila, were there any specific questions?
No, it's just been conversation, and I just answered a question in regards to breastfeeding among the Black community. And, you know, it's I think that depending on the job, and even from my experience, because I'm in the field a lot, so navigating how do you continue pumping when you have a schedule where you're all over the place, or you work a job that does not accommodate, you know, the timing and understanding how to be able to continue to do it successfully. I mean, I loved breastfeeding, but I hated the pumping and trying to figure that out. And I work in the field, and no one really talked about the scheduling and the timing of being able to do that. It becomes very difficult. And a lot of times, if you miss those times to be able to pump, then your milk supply can definitely continue to drop. So that is a continuing struggling thing. I do appreciate that a couple of our schools that we've worked with, high schools accommodated space and time and storage for those students that decided to breastfeed, to continue to be able to breastfeed and be able to keep that going even while they were in school. So that was great. But that also poses difficulty if you work as a waitress, or if you're working in a place that just does not accommodate fitting that in. It just becomes harder to be able to keep up.
Yeah, and I'll just share, it was very difficult to continue breastfeeding after my daughter was born, when I was traveling to Springfield and lobbying and jumping into one meeting from the next. I will say that we do have a state law in Illinois that requires all state buildings to have a lactation room, or relaxation room is what we call it at EverThrive, Illinois. However, that is just state buildings, right? It's not all of the WIC clinics. It's not every place that you go to shop or when you're out and about. So we have a long way to go when it comes to making sure that people can pump in clean and private places. Any other questions, Sheila, in the chat?
So there is a question in regards to someone stated advocating for maternal leave, like 6 weeks, isn't worth a bill. And I would just say that is one of the things that I was really excited about, the Medicaid expansion, because some of the dialogue that I've actually had with those that missed that 6 week time frame for their appointment and had to reschedule, and when they rescheduled, it was outside of that 6 week time frame, and they didn't have the same health coverage as they once had when they were pregnant. So this was definitely a lifesaver for people to be able to follow up, even if it was outside of that 6 week time frame. A lot of times, I would even use my sister, for example. Her job gave her the time off, but it was as if she was furloughed and it was without pay. And especially if a household is heavily reliant on that income, many individuals return to work before that 6-week time frame. I've known of individuals returning to work at least 4 weeks after delivering because they were just in need of that pay. And so to be able to go back to work and try to, recoup on consistent money, that is another reason why they forego just even their postpartum checkup, because they know at least they're making sure that their kids are going in for their well visits. There was another question in here that was asking a question in regards to the WIC program and Senator Duckworth's legislation. Betty, if you can, did you answer that, Kelsey? I'm sorry.
No, I haven't answered that. Betty, do you want-
Okay.
Yeah, I recently learned this year that diapers are not covered by the WIC program. And I know Senator Duckworth entered legislation to get that covered, but is there anything in Illinois legislation that would help? I just can't believe that, food stamps or whatever the program is, doesn't cover diapers. Number one, they're super expensive. Number two, it's not something you can go without. It's like going without pads for your menstrual. I mean, how is that just not available to mothers and poor parents?
There is a bill in the Illinois state legislature that would allow people to use their SNAP benefits towards diaper purchasing. The WIC program is very stringent. They are technically a public health nutrition program. So they're very resistant to adding things that are not food. However, it would be wonderful, to your point, for us to be able to use those benefits towards diapers. Diapers are incredibly expensive. I will say that you can use TANF benefits to purchase diapers. However, the TANF program has a number of problems that we could spend a whole nother webinar talking about.
And just to highlight, Betty, this has been something that we have been a part of figuring out how to create the right bill that will pass both houses, both the House and the Senate, and sometimes it just doesn't pass one. And so it's back to the drawing board to figure out how to reformulate that particular bill so it can pass both places to succeed. It's definitely something that has been a feedback that a number of families have been encouraged to say that would definitely be a support to them. But for whatever reason, it doesn't pass the legislative arms to be able to move to the next step. So it's something that we just continue to keep working on to figure out how we can make both parties agree and pass it.
Thank you so much.
Thank you for all of these great questions. I'm going to turn it back to Jill because I know we are a little bit over time, so I apologize.
They're great questions.
These are fantastic questions. Thank you so much to both of you. It's one thing to look at facts and figures, but Sheila, when you bring this wealth of knowledge from the field, it really, really gives it shape, and it really brings it home. So did anyone have any last questions? Or if you do, just sort of put them in the chat. We'll get them answered.
Yeah, what we typically do is put all the questions in a chat and give them to our speakers, and we'll, when I do a follow-up, you'll see the answers in a sentence form too. Happy to do that. So thank you. Terrific questions. My goodness, there's lots of work for all of us to do. And I want to thank you so much, Kelsey and Sheila and Shannon, for enlightening us. Really, really important that we're all part of this. I want to quickly jump to some of our upcoming spotlights. June 28th, we're having a program on gender identity with a speaker from Keshet about a transgender person in a family and how they were helped. July 28th will be a voting update on Senate Bill 1 and House Bill 4 and Illinois laws. It's such a moving target that we won't know till beginning of July what's going on with that. And then August 23rd, police accountability. And again, that the details we're working out. Deborah, upcoming NCJW programs.
The only thing we have upcoming is our leadership celebration on June 15th. It's when we will be introducing our new board and honoring our other leaders and talking about our new leadership program. So June 15th, and you can find information about that on our website.
Super, thank you. And again, I'll be sending, this time it's going to be a long follow-up summary so you can explore some of the resources that we've got there because they're pretty powerful and we've had so much packed into a short amount of time. And Jill, thank you again for getting all these fantastic speakers together so we get the full picture of what we need to do to bring justice to the world.
Thank you so much. And as Sheila said, it's important that we continue to work in partnerships. I see a lot of our partners on the webinar this evening. So let's keep working together on these important issues. Thank you.
Thanks for a great program. Really, it was very elucidating. I got a lot out of the program. Thank you so much for coming.
Yeah, thank you, Jill.
Thanks, everybody.
Thank you.
Thank you.
Good night. We'll see you next month. Thanks, everyone.
Phew, that was good.
Oh, Jill, hi. Yeah. Oh, it
I'm
was
still
excellent.
here,
I mean,
yeah.
I'm just
I don't have
swimming.
yeah.
Yeah.
Oh, that was a whirlwind, and I'm disappointed we didn't get more folks, but I thought the speakers were all very good.
They were terrific. And I think the questions are not easy to answer, but I mean, you know, that they'll be able to get all the questions answered. Yeah.
And I'm thrilled that Betty was there and Crystal was there.
And
And you know,
Crystal
we
was-
didn't have a big crowd, but we had folks from our coalition. We had another SPA. We had a nice outreach effort there.
Yeah.
So
Oh, I think so. And a real good way to
good
follow
job.
up.
Very nice.
Merle,
Thank
you're on
you.
mute.
I'm gonna
Merle.
pop off. Thank you.
Merle, you're on mute. You're still on mute.
I'm sorry that I had joined so late. It's just been a lot going on. Barry had some surgery this morning
There.
and on something removed from his forehead that's like an evolving melanoma.
Hmm.
And